Welcome to the Ask Dr. Deanna show. I'm Dr. Deanna Holdren, your host. Join me weekly as I cover various health-related lifestyle medicine topics that you get to request. This show is for anyone who wants to proactively improve their health position. I hope you enjoy the show. Hey, everybody. Thanks so much for joining today, for listening in. I'm excited to share a little bit of information about sleep apnea. And you may be wondering why I'm taking on sleep apnea. Well, number one, it was a requested topic from some of our listeners. So don't forget, you can always go to deannaholdren.com. You can also message me on Facebook or on Instagram and, submit any requests for topics or questions that you would like to have answered on the show. As I looked into sleep apnea, this is something that I deal with pretty much on a daily basis in my medical practice. And that is because it's estimated that somewhere between, this is a huge range, 4 and 50% of individuals, huge range of people actually struggle with or suffer with symptoms of sleep apnea or issues related to sleep apnea. And for many people, it can be absolutely debilitating. It can lead to other chronic issues. And today, I want to talk about some of the symptoms, but I also want to talk about just a few tips on, things that we can do from a lifestyle medicine standpoint to maybe help make a difference, help improve sleep apnea. So starting off, let's hit some of the symptoms. Sometimes people don't realize that they're having an issue with sleep apnea, and they may need to go and be tested for it. We'll talk about testing in a minute. But some of the symptoms, like how would you know if this is affecting you or not? Oftentimes excessive daytime sleepiness because they're just not sleeping well at night, because they're getting up, frequently during the night or just awakening, just never really getting a good restful sleep. Insomnia, they're waking up all night long. That can oftentimes be a symptom of sleep apnea. Nightmares, believe it or not, are on the list of symptoms for sleep apnea. Sleep deprivation, snoring is a big one. If you're a snorer, this is definitely something that you want to consider. Depression, sleep apnea can actually lead to depression. It can lead to fatigue throughout the day. Headaches are another big symptom. Irritability can be as well. Mood swings, weight gain. I've actually had people, come to me, from the standpoint of weight gain, with sleep apnea as a cause for that. Trouble concentrating during the day, just an inability to focus on something, to focus on your work at hand, to stay on task, on target can oftentimes be associated with sleep apnea. And then also just frequent nighttime awakening, for whatever reason, you don't know why, you just wake up often, more than once during the night. And again, this can all be related to sleep apnea. Well, if it's untreated, sleep apnea can actually lead to hypertension. And of course, hypertension untreated can lead to cardiomyopathy, but it also can lead to things like stroke. It can lead to arrhythmias, so cardiac arrhythmias, abnormalities there. I mentioned cardiomyopathy already. It can also lead to diabetes, to obesity, and even heart attacks. So you can see there are a lot of reasons why, if you're having any of those symptoms, you basically want to get checked out and see what you can do to make a difference. So let's talk about the 3 types. There are 3 basic types of sleep apnea that we typically will diagnose. And diagnosis is usually done through a sleep study at a sleep center. Sometimes you can have them done at home as well, but it's a polysomnogram is basically the test that they do where they hook you up to, several monitors and monitor your sleeping. How long does it take to fall asleep? How well do you sleep, etc. So that's the test that's used. But the 3 types, the first one and probably the more common one is obstructive sleep apnea. And obstructive sleep apnea is basically where there is an obstruction taking place. And it might be from, the structure, just the way a person's structure in their oropharynx is. It can be from enlarged tonsils. It can be from, a large tongue. Basically, as they're sleeping, the tonsils kind of fall into the airway and they obstruct it. Okay. So that can be a big part of it. There is also what's called central sleep apnea, and central sleep apnea is more of a neurologic problem, and it's basically where your body is not telling itself to breathe in a sense, and so you'll basically end up waking up because you have stopped breathing during the night. And then there's also a third type of sleep apnea called complex, and complex is basically a combination of both of these. And this is something that we see very, very often, where it's basically a combination, and they'll tell you exactly how many events you have when you do the sleep study and so forth. So why would I want to tackle this topic? I want to tackle this topic because I think there's a lot that we can do from a lifestyle medicine standpoint. And there are some indications that sleep apnea may be associated with inflammation. And I'm always talking about reducing inflammation in the body. So whether it is a local inflammation, you've got something going on back there in the tonsils or whatever, or a systemic inflammation where you've just got inflammation throughout the whole body. Both of these have been implicated with sleep apnea. So, when I talk about, issues with systemic, it could be food, it could be environmental, it could be allergies, it could be, metabolic syndrome, which we've done an entire podcast on metabolic syndrome in the past. But basically we want to look at what can be done, what are the treatments here. And so the first thing, because sleep apnea is strongly linked to metabolic syndrome. And we know that metabolic syndrome is basically diabetes, it's hypertension, it's high cholesterol, all of that together. So the first thing is to address that. And the root of that is oftentimes insulin resistance, especially for that type 2 diabetic. That's who we're talking about, but basically the insulin resistance. So go back and listen to some of the podcasts on insulin resistance, on intermittent fasting, on, keto style diet, and basically using that to lose weight. I had an amazing testimony or basically a patient who came in this week who listens to the podcast and started implementing some of the intermittent fasting and some of the guidelines that we've talked about. And I had to do a second look because I almost didn't recognize her. I recognized the name and other things, but basically she had dropped 30 pounds, and it was just by following the advice, on those podcasts. So that makes a huge impact, okay, on a person's overall health, how they're feeling, how they're sleeping, and certainly if they have some issues with sleep apnea, that's going to have an impact there as well. So definitely we want to be mindful of these things and make a difference wherever we can. In addition, when you look at sleep apnea, there are some other things that can kind of be, related here. GERD, or gastroesophageal reflux disease, actually can contribute to sleep apnea because, again, if a person is having this reflux, they're going to have local inflammation and irritation, or what I call road rash. When you go running through a parking lot or a sidewalk and you fall and you go sliding, you can remember doing that as a kid, I'm sure. You get this road rash all over your skin, right? Well, imagine that on the inside. And if you've got reflux, gastroesophageal reflux disease, that is in fact what's happening. It's an irritation that your body does not like. It's going to hurt sometimes when you eat food and so forth, but it's also going to cause that localized inflammation, which will contribute to sleep apnea. So that's something that we can check. One of the best ways to address that, there are certainly medications that will address GERD, but diet is huge. Diet is king when it comes to GERD. And oftentimes eliminating the grains from the diet can make a huge difference there. Grains, and then also some acidic foods. Also, check for thyroid issues, because if somebody has an underactive thyroid, maybe they have one and they don't know it, that could also be contributing to some sleep apnea. Or if they've got a thyroid goiter where their thyroid is swollen, they may not know that either. And again, because that is pushing on the airway, that could potentially be adding to the obstruction and causing a problem. And then finally, nutritional deficiencies can be linked to sleep apnea as well. And specifically, we know that things like N-acetylcysteine, or NAC, that's one of my favorite supplements. It's fantastic fantastic for the immune system. It helps to boost your glutathione levels. It's a product that we actually have available at deannaholdren.com. And NAC has been shown, there are some studies that will show that it actually has a positive impact on sleep apnea, as does vitamin D. So if a person is deficient in vitamin D, they are more likely to have issues with sleep apnea. So in addition to those tips or those nutritional things that you can do, lifestyle medicine. Also, a lot of times people end up after doing their sleep study, they end up being fitted for what's called a CPAP machine. You probably know somebody who uses that, and those work very well at basically treating the condition and making a huge difference. And for some people, it is absolutely life-changing when they get this sleep apnea under control and treated, well treated. Surgery is another option. There are some surgeries that can be done for sleep apnea, especially if there's obstruction going on, something needs to be removed, etc. There are some oral appliances, some medications that may be used as well. And then again, the biggest one in my mind is the weight loss. You cannot go wrong with that. So I hope this has been helpful. If you, are having any of those issues that I mentioned at the beginning, any of those symptoms, I would encourage you to talk about it with your doctor and see if, maybe maybe you have sleep apnea. You don't have to be overweight to have sleep apnea. That's the other thing. Oftentimes people think that it's just in patients who are overweight, and that's just simply not the case. So you don't have to be overweight, but if you're having any of those symptoms, talk to your doctor. Maybe you need to have a sleep study to help you, figure out what is going on. So thanks so much for joining me today. I hope this has been helpful information for some of you, and I hope that you'll plug in next week. We're going to talk about nutrition and just really lifestyle medicine and how it relates to anxiety. We've got a lot of anxiety going on out there right now, and we're going to try to calm some of that down and make a difference. So thanks so much, everybody. Have a great day. I hope you enjoyed that episode. For more information, visit me at deannaholdren.com. Find me on Facebook, Instagram, and Twitter at Dr. Deanna Holdren. I really want to hear from you, so message me. I love taking your messages and creating topics from them. Please rate, review, subscribe, and share my show with those who have an interest in health and wellness. Thank you for tuning in, and see you next week.